The CDC suggested new shots for 6 months or larger. The Florida government Ron Desantis administration made advice against updated COVID-19 shots for people under 65 years of age at the beginning of this week for 6 months or older federal agencies. Governor said on Wednesday, "I will not be left and I will not allow FDA and CDC to use healthy fluoridians as a guinea pig for unproven new strengthening shots, the first state to provide shield and guidance." In the virtual roundtable discussion, DeSantis on Wednesday, State Surgeon General Dr.Joseph hosted Ladapo and external health experts. Ladapo adopted vaccine-septic ideas and allegedly changed data to suggest vaccines create a higher health risk for young men than they really were actually for young men. To say that I have removed an analysis is an implicit denial of fact. Public is recipient of prejudiced data and comments. At the roundtable meeting of Wednesday, Ladapo announced what his department was doing. Ladapo: "What I direct our department is what I direct to everyone under the age of 65. The use of these mRNA COVID-19 vaccines really recommend guidance, provide guidance." He said, "Only at this point, with the amount of immunity in the community, almost every walking person has some immune and safety and activity, especially security. My decision, this point for young people and people who are not at high risk, this point it is not a good decision." He added, according to the Florida News Bulletin, Florida advocates his position because suggestion was based on the fact that new FDA-approved COVID strengthens lack human clinical research and benefit or activity evidence. Similar to flu shot, updated COVID vaccines have been set to match existing substances. Safety profile vaccines has been based on meticulous clinical work with tens of thousands participants in 2020. And since then continuous security monitoring. On Wednesday night, Director of Disease Control Centers.Mandy Cohen responded to the comments of Florida's Surgeon General. The booster RS fires were proven safe, effective, FDA CDC thoroughly independently. Public health experts are in a wide harmony about these facts and their efforts to reduce vaccine intake are unfounded and dangerous, he said. According to the Disease Control and Prevention Centers, COVID vaccines have gone through meticulous security and activity standards through clinical studies, including tens of thousands of participants. Ageans says that shots are under the most intense security monitoring of U.S. history and that millions of people have been vaccinated. FDA Center DirectorPeter Marx. People. These updated vaccines of the agency's security, efficiency and production quality for meticulous scientific standards can be sure. Florida's guidance suggested that the US Food Pharmaceutical Administration permitted to shoot children aged 6 months to 11 years approved for 12 years older suggest